My next guest, let's just say their name says it all right? The Free Medical Clinic. They're located at 1875 Hardin Street, Columbia. And my guest is Freddie Strange, Executive Director. Welcome to the show.
Thank you for having me.
It's a pleasure to have you. Yes, it's a pleasure to have you here. And, it's kind of hard to believe that medical services could be free, but I'm quite sure there's a certain criteria that has to be met. But if you would, introduce yourself to our audience.
Yes, as Koko mentioned, my name is Freddie Strange. I'm the Executive Director of the Free Medical Clinic here in Columbia, South Carolina. We have been operating since 1984. We are currently located at Hardin Street. We provide primary care, specialty care, and pharmacy services at no charge to patients who live at or below 138% of the federal poverty level, are uninsured, and have no Medicare or Medicaid.
It has to be both.
Correct.
Okay. All right. So how do you know what 138% is below? How do you determine?
That is established by the federal government, and there is a graph we follow.
Okay.
Or chart.
Okay. All right.
138% of the federal poverty level for an individual is about $16,000 a year.
Okay. And you have all of this information on your website, too.
Correct.
Yes, yes. Tell us your history and how it got started.
Well, yes, the Free Medical Clinic was formed or established by Dr. Bill Balknight of Trentham Road United Methodist Church in 1984 on Brabham Avenue. In 1994, the clinic moved to our current location, 1875 Hardin Street, and we've been in operation ever since.
Okay. And how are you funded?
We are privately funded. Our largest funders here in the community are the United Way. Mm-hmm. The 3 hospital systems all contribute both financially and in-kind services. We could not function without the hospital systems. They provide labs, imaging, and specialty care that we can't perform on site.
Okay, so walk us through the process. You're saying that you cannot have Medicare or Medicaid, and then the income guidelines of approximately $16,000 or less. Do you go to the clinic and sign up first and get on file, or how does that work?
Yes, we are a walk-in clinic.
Oh, okay.
And when a patient comes in, there's certain information that they should bring with them. Mm-hmm. That, too, is on our website. We need proof of residency, an ID, social security number, proof of income, last 3 pay stubs, either a W-2 or your 1040 from your last year.
Now, I understand that there are some services you do not provide, so we need to be clear on that as well.
Correct, Koko. We do not provide dental care.
Okay.
We refer that to well partners. Mm-hmm. We do not provide optometry. We do not provide eyeglasses for reading and vision correction. We do not provide birth control, treat sexually transmitted disease, nor do we dispense narcotics from our pharmacy. We refer pregnancies over to the University of South Carolina School of Medicine, and we do not see pediatric patients. Our age range is 18 to 65.
Okay, and so it's really a good idea to make sure that you go on the website, too, to make sure what services you provide and don't provide.
Yes, please see our website about our admission criteria. We don't want anyone to drive down and be disappointed. We will, however, help them get to where they need to be.
Okay, well, that's pretty simple, very easy to follow. And like I said, all of this information is on the web because I want to make sure everybody is clear what the guidelines are, because yes, you don't want everybody just rushing in trying to get free medical care,
Correct. Our guidelines for participation are on our website, and we're currently posting our documents that a person or a patient should fill out when they get to the clinic, so they can actually print those, fill them out, and bring them in with them.
Okay. All right. I understand that you also are in need of volunteers.
Yes, ma'am. Mm-hmm. Absolutely.
So what kind of positions are available for volunteers?
Of course, we love our volunteer doctors, nurse practitioners, and registered nurses.
Okay.
We also look for administrative assistance through volunteers. Mm-hmm. I can always use help with the custodial duties that we have to perform around the building. We operate as a multi-specialty medical clinic. There's always work to be done there.
Okay.
Either indoors or outdoors.
Cool. And donations are always acceptable.
Very much so. Very much appreciated. For physical donations, we can always use paper products, i.e. toilet paper, paper towels, and copy paper, and of course, money.
Yes, the green always
Absolutely.
works. All right, tell us your website address and a phone number that people can get in touch with you.
Our web address is www.freemedclinic.org. Our telephone number is 803-765-1503. And please like us on Facebook as well.
All right. What a wonderful service that you're providing for the community. I can imagine that you're packed every day.
It's very busy. It is a mission here in Columbia.
Okay. And by the way, what are your hours?
We are open from 8 until 5 Monday through Thursday, and from 8 until 1 on Fridays.
All right. The Free Medical Clinic here in Columbia on Hardin Street. And again, the website?
www.freemedclinic.org.
All right. We appreciate you. And you've got an open door invitation to come on and share with us some of the things that you're doing. Just let us know.
Thank you very much, Koko.